I am Bharti Patel. I am the National Executive Director of the South African Federation for Mental Health. We focus on the human rights of persons with mental disability. We try to uphold the rights of persons with mental disabilities, and we try to achieve the highest level of mental health for all. As a national organization, the South African Federation for Mental Health works with stakeholders at an international level, a national level, and at a provincial level. This provides us with great opportunity to learn about good models that are practiced internationally, to be able to implement those models at a local level, but we also provide input to government. We provide submissions to national government in terms of policy decision-making, and we are able to guide policy in the country. We also work closely with our 17 mental health organizations that are based in communities, and therefore we have a local footprint, understanding the needs of communities, understanding the needs of community-based organizations in terms of how they provide services, what the needs are in terms of making sure that mental health care users' rights are upheld.
We were all worried in case we were going to die. I was worried myself, and I had to listen carefully to the adjustments we had to make, and I had to adhere strictly to it in great concern that I will not get sick.
COVID-19 actually exposed mental health for what it really is, as literally each and every person's mental health on this planet has been affected.
Mental health problems have increased tremendously. It has changed everything, everybody's lives, and especially our work as well. There were times where we were just not seeing anybody in our offices. Our workshops were closed. We were only doing telephonic counseling. We were doing virtual counseling. And virtual counseling is just almost like a crisis intervention, giving information. It's very different.
We have now been hit by COVID with the actual disease, but right up until recently, we were just dealing with the huge anxiety and fear of how COVID would affect us. And just when you think it's safe to come out, bang, here comes COVID again. That isolation, not getting your usual contact with your family, not having your usual social contact by coming to the protective workshops. And the saddest part is so many of our service users don't really know why this is such a difficult time. They just know they don't like it. We've lost funding, we've lost business work with our protective workshops, income, we've lost donors, and on top of that, we've had to continue to buy extra PPEs, buy extra sanitizers and gowns and all the crazy stuff that you have to buy for COVID. So it has hit us hard.
I can't see my members, but I communicate with them via telephonically, via WhatsApp and SMSs. But I notice so many small things that I think I'll take for granted that I miss and be like, flip, now it's my birthday. Maybe if I was around them, I would have had this with all the hugs and all of that, So I miss those things. I even miss the hug.
South Africa's policies and legislation were definitely not geared towards dealing with something like a global pandemic. Even before the pandemic, our policies, our mental health legislation were not really being implemented effectively, and people who needed to benefit from it were not really feeling those benefits. One really important aspect is that the policy for emergency services didn't make provision for emergency mental health care, and I think that shows how mental health isn't always seen as a part of the response to crisis situations in South Africa.
When we look at COVID now, that has affected so many people. If there were no community-based organization, I don't think they'll be able to survive, since they need so much of trauma debriefing, they need so much of counseling, there is so much of loss within themselves. Others have lost jobs, others have lost their family members, so there is so much that the community needs from us.
We have walk-in populations that come in, and the vast majority of them cannot access our kind of services or any kind of services unless it was provided cost-free to them. I think the important thing is for all people that are part of community organizations to be part of the society they live in. Also, it allows society to understand that this is normal.
Community-based mental health care is critical to the well-being of mental health care users. When you find people leaving hospital after being treated, they are diagnosed and they have very little idea of how to manage their lives. So we look at reintegration into the community, and you need a whole lot of support around you to be able to fight the stigma. So there needs to be partnership, there needs to be collaboration. When we look, national government provides policy. That is where policy is set, and that is where decisions are made in terms of allocation of services. However, provincial governments also allocates resources to these organizations. And that's where the disparity lies. We need to see all provinces having standardized programs for mental health. We need to see that there is equal allocation of resources, but also a greater collaboration between the NGOs and government so that the rights of mental health care users can be upheld.
When we do our awareness talks, we usually do it at the community hospitals, at schools, we do it at organizations, our local organizations within our area that we work in. And there are still people that would say, oh no thank you, I'm not interested. If they hear the word mental health, they're like, and so it's really, really important to bring that awareness, to start having those conversations about mental health.
Our vision for Mentally Healthy South Africa is to see the acceptance, first of all, of persons with any mental health issues. I'm also diagnosed with major depression and anxiety, so it's a struggle for me daily. And I experience that people do not accept this. They label you, they think you are crazy, they think you are weak, and that's not true.
Hello everybody, my name is Clement Peterson and I'm diagnosed with schizophrenia. My type of illness doesn't really let me stand out, but people still somehow perceive me as different. But I know they're talking behind my back. Some people avoid me also. I don't feel nice, I don't feel right about things like that, yes.
I am diagnosed with intellectual disability. And sometimes it feels like I'm a burden to everyone else.
I have an intellectual disability. In the community, I feel very stigmatized. They look at you differently, as if you're not able to become independent. We are all human, and we are all living in a world where we should be loved and be accepted.
My wish is that one day I wish I could wear a graduate gown, see myself and making my parents proud of me. And I want to tell everyone that they must respect our disability and understand, because we didn't choose to be like this.
Sometimes I do feel like I'm treated like I'm a danger to society. People need to get to know us better, and then they will relate to us in terms of how they, judge us, perhaps.
I think what needs to change is also with the families at home. That if my son comes home and say, oh, so-and-so was behaving like this and that, or, saying all the negative things. I need not to laugh with him on that subject, but to educate him and let them know that there is mental illness, that people shouldn't be laughed at.
Most of the mental care users that we save are coming from a disadvantaged community where no one notices them. So our role as social workers that are working at mental health is to make sure that we empower them to be heard. We make sure that they also believe that they are people, because most of them, they've lost hope. They don't think they exist, they are people. So what we do here is we make sure that we empower the mental care users, we empower their families, we empower the community. There is no health without mental health.
Human rights for mental health is quite critical. We live in a democracy, but mental health has always been the least prioritized. South Africa is a signatory of the Convention on the Rights of Persons with Disability. Upholding human rights provides people with inherent dignity. And I think if we can see mental health care users as equal citizens, then we will be able to make sure that they get access to services, access to accommodation, and accessible to the rights that they deserve.
Our centre yonder, where we are situated and where we render services to, is such a big place of empowerment and skills development for our service users. They can come here, be in a protective environment where they can use their skills, where they can learn new skills and not have the same pressures as in the open labour market.
When we get service users that we know can work outside in the open labour market, but business don't like to employ them, then we go and buy that business. We did that with the nursery. And we moved the business to this premises. We did agricultural courses with some of our service users. And now we are the biggest wholesale nursery in the Northern Cape. They're not a Yonder or a Northern Cape mental health service user anymore. They are now employed by us and they get a salary. And that's important. They're proud of what they are doing.
Ek werk by Yonda, ek is by die groenmekwekery. Ek is dan groenmekwekery volgens die landboukrisis wat ons het nou, die tak wat ons doen, om ons kom leer van groentes. Wat ek buite kwam was nie sommer so maklik om te help te kry van mense af. Mense het ons nie verstaan nie. Hulle het ons meer afgebring in plaas van opbring. Dis why het ons Yonda toe gekom om te help te kry.
Our services are within the communities that we provide, where we provide services to, and we have 22 various programs or projects. And these are in the areas of firstly intellectual disability for children and adults, as well as services to people with mental disorders. So the full range, again, these are people with severe mental illnesses or your common mental disorders. And then a third category of our work where we focus on prevention and providing support and counseling to anyone who needs mental health support.
In our organization, people with disability constitute about 1% of the workforce so far. We have a plan to increase it. We want to set an example to other organizations that we can give employment to people living with disability and also contribute to destigmatizing mental disabilities.
Ek is Elsa Muller. Ek woon in Kimberley by Yonder Sentrum. Ek werk nou al 7 jaar by Beefmaster en ek is baie trots op my filing werk wat ek doen. Ek weet presies waar alles kom en as hulle my vra, dan help ek nog met die training se filing werk ook, want ons sit dit presies agter mekaar soos dit moet wees.
To better prepare a lower middle income country like South Africa for something like a pandemic. I think what needs to happen is that, yes, we want to obviously see more investment into mental health and we want to see better resourcing, but I think there needs to be a recognition that mental health is so much more than just something that sits in a bubble. Mental health is related to social services, medical services, emergency planning. It should be a part of everything. And I think for countries like ourselves to sufficiently prepare ourselves for crisis situations, we need to see that almost a mainstreaming of mental health where it becomes part of the everyday conversation, whether we're talking policy, whether we're talking about contingency, emergency planning, mental health should be a core component of that at all times. Us in the mental health sector are hoping that we are going to see a review and a refresh of our mental health policy framework that lapsed in 2020. What we want to see is a policy that now takes into consideration things like COVID-19 and other challenges that might come our way. We want to see more resourcing. We want to see better implementation. We want to see the lines between national and provincial government becoming clearer in terms of accountability. Because of our decentralized model of governance, national develops policy, provincial implements it, but that line often is broken and the one doesn't speak to the other, and that leads to poor policy implementation. And those are the kind of things we want to see change in the future.
There's one thing that I feel as a country, as South Africa, we need to improve on, that is to take mental health seriously. To say that our government is really prioritizing mental health is when I see that the national health budget for mental health increase, because currently the national health budget only allocated 5% to mental health services, and that is not enough.
Within South Africa, we see that there is no parity in terms of subsidies paid towards community-based organizations. You will find in one province an allocation of 5%, and in other provinces, less than 2% is allocated towards community-based mental health services. We find that almost 95% of the budget is allocated towards hospital services and very little towards community care.
It's kind of a stuck record for mental health because the mental health organizations around the country, and I think Pietermaritzburg is no different, are all battling with finances. The government does not recognize the need. We're doing fantastic work on, I call it the smell of an oil rag. We should be proud of the work that we do, but we're scraping the barrel here. We could be doing so much more with the right kind of staff who have been paid the right kind of salaries and the right kind of upskilling our staff, training, and then providing amazing services to our clients, our service users. That would be improved with the right kind of financing.
We don't get that support from government. If you see the budget, if you see the health budget and where mental health fits in, I wonder if it's 1 or 2%. I don't think it's 2%. But they don't do anything. They don't have statistics on mental health patients that enter their facilities. We have to jack that up.
It's not just enough them coming to a clinic, get the medication and go home. There's aftercare services that also needs to take place because it's not all of them that gets admitted to institutions such as ours because obviously of a limited amount of people that you can house at a place like this. So government should really look at their funding, and that will enable that more services such as outreach and awareness can take place.
My concern is the next wave of COVID, not the physical one, but the mental one. Because I think we are sort of slowly seeing the after effects of what COVID physically and medically has done is becoming an emotional and a psychological and a spiritual issue further down the line. What can government do for mental health? I think the realization that mental health is as much an intricate part of human life as physical health, number one. I think if that light bulb moment can happen, and the mental health as a sector, but also mental health generally can be identified as a real essential, not just in words. And we see that happening in finances coming through, in government physically stepping in and saying, right, we want to have the following. It's a huge job. And I don't think people understand just how big mental health is.
Mental health is more than medication and diagnosis. It is about getting access to employment, access to housing and accommodation, to being able to live independently in the community. From a national point of view, we would like to see greater allocation towards community-based care. It is actually cheaper to provide care in the community. We need to see this as an investment rather than a cost saving.
One of the things that COVID-19 has meant for mental health is that it has, to a certain degree, normalized the idea of mental illness, or even if you don't have a diagnosed mental illness, it's normalized the idea of saying, I struggle with anxiety, I'm feeling stressed, I'm feeling isolated, I'm feeling fearful because of my physical health, my livelihood being under threat, my family, my friends being exposed to a potentially life-threatening virus. And so I think it's time for us to capitalize on that, to say, while it's okay to talk about mental health, let's do as much as we can at all levels of society, from government to grassroots level. Let's bring mental health out of the shadows. Let's break the silence. Let's fight to make more resources available to make sure that mental health is on everybody's lips.
Before COVID-19, it was closeted. People were not wanting to talk about it because it's so stigmatized. Now everybody's talking about their mental health. And we want to use this opportunity to say that our mental health is as important as our physical health. And this is the time to get support.
I would wish that more people would be aware of it and that people wouldn't be so afraid of speaking up about it and they wouldn't feel so bad and stigmatized, that it isn't such that thing on the sideline. It's actually important that more emphasis is put on it.
Speaking out is probably the biggest thing because there's a silence and there's a stigma attached to mental health, which I really hope we can break, because people are too scared that they would be dealt with differently, that they would be treated differently if they speak out and if they say, I'm not okay. We all find ourselves at some stage not feeling okay. And if we can deal with that earlier rather than later, there's so much more that we can do.
I love working in the mental health sector because even at a national level, it's extremely rewarding to, at the end of each day, sit back and look and go, maybe I made a difference somewhere. Maybe somebody somewhere learned something through the work we do. Maybe we helped somebody who was desperate for help. And yeah, it's a privilege to work in the field. It's not the easiest, but that's why we work hard every day to try and make a difference.
I want to speak my mind about the human rights of persons with mental illness. I want to speak my mind to make sure that we get greater investment for mental health. I want to see services accessible in the community. I want to see people enjoying their mental well-being and being able to ask for the services and get the correct services that they do deserve.
You and I, each one of us, have a responsibility to speak about the things that bother us and not to be fearful of what people think. Because the more we bring what bothers us out into the open, it makes a difference in how people perceive mental health. The more you and I, speak about the things that cause us pain, that cause us grief, that cause us to stand back and to be fearful of life, the more we can liberate ourselves. And that is good mental health.
There is no health without mental health, and mental health is as important as our physiological health. The challenge that we have is people out there, they are prioritizing their physiological health. They'll put the makeup and everything, and at the end of the day, they'll be neglecting their mental health. Let's talk about it every day, let's accept it, and people out there will be able to come and consult. So prioritize seeking help every time when you're having mental health-related illnesses and or aspects. I thank you.
I want to urge one and all that mental health is very important. Let us start at schools and make it a subject. Let every child, every adult learn about mental health. It's going to take us a long way. At some point or the other, we're all going to have mental health issues, and we won't hide, we'll go for help. Help is available as quick as you want.
We all need very good mental health. And with the COVID-19 pandemic, we have all been affected somehow. I want you to speak your mind about us needing to prioritize mental health. I want you to speak your mind about the fact that mental health is as critical as the physical health. I want you to speak your mind about mental health becoming a reality for every citizen of this world. I want you to speak your mind about the right to access mental health care so that there's mental health for all.
Please, let's educate our children and let's educate ourselves and make sure that we take care of people with mental illness.
It takes only one whisper in 2 ears to make a difference.
I choose to speak my mind about mental health issues. Accept who you are and know that you are not alone. You are not weak. You are, in fact, very strong.